What if I told you that some of the tests your doctor's office schedules for you automatically, year after year, might actually be doing you more harm than good once you cross a certain age? Not because your doctor doesn't care, because the science on when to stop has quietly changed, and almost nobody tells patients when that happens. I'm Dr. Ethan Cole. I've spent the last 20 years running a small primary care practice here in Portland, Oregon, and if there's one thing that's stuck with me through 2 decades of patients in their 60s, 70s, and beyond, it's this. More testing is not automatically better testing. Sometimes finding something isn't the win it sounds like. Sometimes it's the start of a cascade you never needed. Major national reviews of preventive care have found that for several common screenings, the balance quietly flips with age. The harms of false alarms, unnecessary procedures, and overtreatment start to outweigh what the test can actually save you from. Today I'm counting down 5 medical screenings after 60 where that's exactly the case, ending with the one most people are still told to get every single year, no questions asked. Stay with me to number 1, because the numbers on it might genuinely change a conversation you have with your own doctor. Before we get into it, if you think this list could help someone you love make a smarter, more informed decision, hit subscribe right now and share this with someone who needs to hear it. A parent, a spouse, a friend who mentions their annual checkup like it's non-negotiable. Number 5, the routine EKG, ordered even when nothing's wrong. It's often tucked into a physical without you even asking for it. Here's the mechanism. An EKG traces your heart's electrical activity, useful when you have symptoms. But as a blanket screening test in someone with no chest pain, no shortness of breath, and low overall cardiovascular risk, it doesn't reliably predict who will have a heart problem. Think of it like checking the oil in a car that's running perfectly. You're not catching a hidden failure. You're just generating a number that might send you down a road of more tests. A major national task force review concluded that in low-risk adults without symptoms, screening EKGs add real potential for harm. Unnecessary invasive follow-up, overtreatment, being labeled as having a heart problem, without solid evidence of benefit. I think of Frank, 63, a retired mail carrier who came in worried after a routine EKG flagged a minor abnormality. 2 more appointments and a stress test later, everything was fine. He'd just spent 3 anxious weeks over nothing. The move: if you have no symptoms and your risk factors are already well managed, ask your doctor whether that annual EKG is actually earning its place. Don't wait for the next physical to ask. Bring it up tonight if you have one scheduled soon. Number 4, carotid artery ultrasound screening with no symptoms. This test checks for narrowing in the neck arteries that feed your brain, a genuine risk factor for stroke. But here's the part almost nobody talks about. When a national task force reviewed the evidence for screening people with 0 symptoms, they concluded the harms outweigh the benefits, largely because so few strokes are actually caused by this specific narrowing, and false positives can send otherwise healthy people toward invasive procedures they didn't need. Diane, 67, a retired teacher, had a routine scan flag moderate narrowing. She spent months anxious about surgery before a specialist confirmed her risk was actually low and medication was the better path. Not a scan. A prescription and a walking routine. If a screening ultrasound is ever proposed and you have no stroke symptoms or history, ask what specifically changes about your treatment if it's positive. Tonight's the night to write that question down. Number 3, cervical cancer screening past 65. For decades, women were told, keep getting Pap smears forever. But the data tells a different story now. A major task force concluded with moderate certainty that once a woman has had adequate prior screening and isn't otherwise high risk, continuing past 65 doesn't provide meaningful additional benefit, while it does add unnecessary procedures. Carol, 64, a church volunteer, had been getting Pap smears every single year for 40 years. When her doctor explained she could safely stop after one more clean result, she said it felt like being handed back a piece of her calendar. If you're watching this and you've had one of these 5 screenings recently, drop the number in the comments. I read every single one. Number 2, colonoscopy after 75, and especially after 85. Screening from 50 to 75 has strong, well-established benefit. But the data on continuing past that gets murky fast. Modeling shows few additional years of life gained by extending screening past 75 in people who've already been adequately screened, while the physical risks of the procedure itself, like bleeding and perforation, climb with age. Walter, 78, a former high school coach, assumed his colonoscopy was simply automatic for life. His doctor walked him through his own health status and screening history and made the case, together with him, that he could stop. He told me it was the first time a doctor had ever explained the why behind stopping something instead of just adding more. And now, number one. The one almost every man over 60 has heard of, and the one where the numbers might surprise you most. Routine PSA testing for prostate cancer. Here's the mechanism nobody explains well. PSA can rise for reasons that have nothing to do with cancer, and in men 70 and older, the false positive rate approaches 50%. 50%. That's a coin flip. On top of that, most prostate cancers found in men this age grow so slowly they were never going to cause harm in that man's lifetime. But once found, many men choose treatment anyway, and treatment carries real risk. Long-term incontinence, long-term erectile dysfunction, sometimes bowel problems. This is not don't get tested. This is make it a real conversation, not a rubber stamp. Robert, 71, a semi-retired accountant, had gotten a PSA test every year since he turned 50 without ever really discussing it with his doctor. When we finally sat down and talked through his actual risk factors, family history, and what he personally wanted, he made a different, informed choice, and told me afterward he wished someone had had that conversation with him a decade earlier. So let's bring it back. Number 5, the routine EKG with no symptoms. Number 4, carotid ultrasound screening in healthy people. Number 3, cervical cancer screening past 65 with adequate prior results. Number 2, colonoscopy pushed past 75 or 85. And number 1, PSA testing without a real conversation about the risks. None of this means skip your checkups or ignore your doctor. It means walking in and asking, does this test still make sense for me at my age with my health? Your body isn't broken just because a guideline changed. Knowledge is power here, and the small choice to ask one more question can spare you months of unnecessary worry. Take care of the only body you've got. And remember, the best screening is the one that's actually earning its place in your care.